It was interesting when we first started doing this work, you and I discussed it 17 years ago. We discussed the possibility of doing these nasal washes, and you didn't have your doubts, but
No.
you questioned the efficacy of it. And
That's
you
correct.
said, we have to be sure that we're right here.
Right.
As a veterinarian, you take that really seriously, especially with infectious disease. So there was a period of time that if we knew a horse was going to have a transtrachea or a BAL, we would do that nasal wash before.
Exactly. And we got the same results.
Every time.
We did, for a year, we did transtracheas, nasal washes, and BALs on certain horses. We didn't do a transtrachea and a BAL on every one of them.
Yes.
But what we learned was every time the cultures came back exactly the same as what we saw in the nasal wash of the BAL and the transtrachea. So we said, why are we putting the horse through this?
Yes.
We'll do this. And what's interesting is this is what the human field has begun to do. So when they have MRSA infections in a hospital, they don't do a transtrachea or BAL, they do a swab of your upper airway.
Yes.
They stick a swab in your nose.
Yes.
They just proved a study recently in the BBC and a Lancet article where they took sick young children in the human field and they turned around and did an upper airway flush, i.e. a nasal flush, and they cultured that and they did a transtrachea or a BAL, and guess what? The results were the exact same. So we've proven it in the horse, and they've now proven it in the humans as well. It doesn't surprise us at all.
No.
But you are right. We had done it with big time problems at the Gluck Center. We hadn't done it on day-to-day inflammatory airway horses and things like that, but we've really learned that at Kesmarc a lot more. Actually, it could be its paper on its own, for sure.
Well, and it's interesting, too, because you and I here, this article just came out in Trainer Magazine.
Yeah.
And, you and I were chuckling because we've been saying for years and years that the secondary fungal infections play such a huge role in these horses. And the airway disease, I was guesstimating 70%
That's right.
of the respiratory horses have a secondary fungal infection. And people have, they've kind of looked at us like we were nuts. And at the end of the day, this article just came out, and it's true. And and they came up with the theory that because a horse is hypoxic when they're training, the funguses have a better opportunity.
And I never thought of it that way.
I never thought of it either.
We just kept thinking we saw fungal infections, and you will see low-grade fungal issues that are there. But if they're budding and branching, that's a real infection.
Yes.
And if you're getting the sample to the lab within an hour, you didn't allow for that fungus to bud or not set up shop.
Yes.
It's real.
Yes.
And that's what we see. And we've seen our treatments with the hyperbarics, because we're putting them in pure oxygen and diving them, do much, much better with the antifungals and the bacteria. For certain bacteria, we get about 30 to 40% better killing effect of our antibiotics with the hyperbarics. So, I have gone to other farms where I've treated the same antibiotics, same antifungals, and not gotten the same success that I've gotten at Kesmarc. And I think a lot of that is because of the chamber helping us get over the edge and getting them better quicker, especially pre and post surgery on throat issues.
Yes.
When we did that, we clean them up before they go to surgery, we clean them up after they come back from surgery, and they have a better performance when they go back to the track. And I have noticed that. Trainers talk about that. The surgeons talk about that. So I think the chamber is helping us with the other things that we're doing, because we could be affecting this fungus and other things much more. And I never thought about the hypoxia until they wrote that. I was like, okay, that makes total sense. I never thought it was hypoxia. I just kept seeing it, and we treated it, but we didn't know why.
Well, we were blaming it on antibiotic use. We were blaming it on a lot of things, and they were all just nothing. That's so obvious. It cracked. I was just like, oh my God, that makes perfect sense. I have a couple questions too, or I know that the veterinarians ask you questions. What, when it comes to the nasal wash, and when it comes, because it's not in the book yet.
Right.
It's just not. And so in their defense, what are some of the most common questions and the answers that you give?
So let's say you have one horse that comes in from a track, a maiden filly. The horse comes in, it's a little bit puke, it doesn't feel very well, and as much as we'd all love to have quarantining areas everywhere at all these farms, we don't. The stallions get quarantined, but when it comes to the yearlings, 2-year-olds, maidens coming off the track, even the colts that are now coming back, that are either going to get gelded or go somewhere else back to racing again, they might have an injury. It's hard because nobody has quarantining. So what you do is, you do a nasal wash very quickly, and if you see a lot of ciliated epithelial cells, you know to raise your level of biosecurity 1 or 2 degrees. You now wear gloves, you spray the bottom of your feet, you put a stall brake in your barn, and you might dedicate equipment to them. That's very easy to do, and the nasal wash will tell you even before it would take you 4 to 5 days to get a culture back. Now, with the advent of the new PCRs, the nasal wash can actually speed you up, but horses get stressed moving around facilities. So you're going to have low-grade viruses like herpes viruses or other viruses that are not in the vaccine. That's very common. And so a lot of times you don't need to go all the way to the PCR or the ID. If they're not coughing and they don't have high fevers and it's subclinical, it's better to learn what it is from a nasal wash. If you see a lot of ciliated epithelial cells with degenerative cells, and you know there's a problem because the bacteria actually have the gram-positive or gram-negative in it. They actually have, the cells are fighting whatever it is. And then you culture that out and you know what to treat them with. It's not hard to do. And they get over it within 4 or 5 days. No
it's amazing how fast they get over it.
Yeah, we've done, I tried to count it up last night. We were up to 3,000 horses we've done that to. So.
Wow, well, that's... I knew we'd done a lot.
Those are bad respiratory bleeders and things like that.
And
we're up to close to 3,000.
You know, and it's interesting too how much we have migrated towards a different. You have migrated towards a different kind of approach to antibiotics.
Correct.
It certainly is. I mean, first of all, when you do a culture and you know the correct antibiotic, it's amazing how much better the horses get. And in everyone's defense, by the time a horse comes to Kesmarc, very often there's a really serious problem because otherwise they wouldn't have come here. And it's no one's fault.
That's right.
They just didn't fit that mold.
They don't have time at the track.
No.
The problem is there's very few veterinarians and there's 1,500 to 2,000 horses on the backside. So even those 4 or 5 veterinarians that you see running around, they have to do lameness, they have to do health certs, they have to do all the paperwork to get to the races, they have to do all these things, and oh, by the way, they might have a couple of horses with a fever. Well, they're always last. They don't know what to do with them. And then they keep treating with antibiotics and antibiotics and antibiotics because it helped all the other horses. But this one, it didn't help.
And that's the one we get.
And that's the one we get.
We don't
and
get
it's normally problems in the lungs or something like that.
Well, it's
damaging. I got a call today. Great hunter jumper barn in north of town. They were like, oh my God, this horse sounds like a goose coughing. I'm like, well, why don't you send it over to Kesmarc and we will help you. It's in the new term, instead of equine allergies, equine recurrent airway disease or recurrent airway disease, we've now settled on equine asthma. So all the scientists have gone through all these names and they've now settled on equine asthma. And I'm like, all right, we'll call it equine asthma.
It's allergies.
Exactly, it's allergies. That's exactly right.
70% of adult horses have allergies.
That's correct.
It's amazing. And, you know, that's something that you and I have looked at for 17 years. And when it comes to the bleeders and the respiratory horses and, you know, these, we had a horrible allergy horse that's winning Grand Prix in Europe right now.
He won a big thing at
Ireland.
I got a note from them too, just so grateful.
What are your thoughts about a proactive approach? And I've never asked you this, so this is the first time we've talked about this.
No.
What are your thoughts about a proactive approach when taking a horse into training and doing some of these nasal washes before they ever start out, to know if they're an allergy horse?
So I will say I like it. And the reason being is because I think there's two things. I think Kesmarc does a really good job on systems, right? They look at the airway, they look at the respiratory system, they look at how they're dynamically doing what's going on, they look at their feet, they look at their teeth. You are putting a preventive maintenance system in motion, but it's a strategic preventive mechanism. So when you say back to the owners, here's something we learned about your horse. If your horse has a little bit weaker epiglottis and you tuck it in a tight position and you don't deal with the horse's tongue, the horse is displacing. And have you heard about that? And you'll hear owners go, oh yeah, when I make a tight turn on an event, it makes this God sounding, you can't breathe. And I'm like, okay, well, go a little wider, take that. How about we try this as a maintenance solution, as a preventive? And it's amazing how often those work. And they need to stay on them though, because you're right. And it is seasonal. So there are times of the year that respiratory horses are worse in the summer and things like that. And when you go into the winter and it gets a little quieter, it's better. Other horses, though, when you go into the winter and they close off the barn and they lock the doors so they have allergies to the bedding or allergies to the hay, they actually get worse. So it's different for different horses depending on where you're going. And if you could do a preventive approach, it's going to be a whole lot better. And I feel Kesmarc does that right. That's exactly what you do.